After the scene setting by Peter, I'll try to highlight the implementation journey, where we are, what we've been doing so far, and potentially where we're going. So that's the content of my short presentation, where we are, meaning what has been achieved so far, and what is the direction of travel. And I will use the metaphor of the journey. The train has started moving, believe it or not, in January 2010 at the level of the agency. We have established a task force, so it has been a long time ago, it looks like now. We have put in place a very complex, but I think it was worth it to do it, governance structure involving member states, EMA, and also we have established stakeholders fora for us or for you to engage with the overall implementation process. The driving force behind the implementation was always to bear in mind the hierarchy of rules. So at the top of this pyramid, you can see that the regulation and directive are really what we should be following. Stemming out of that, you've got the implementing regulations, the policy and guidance, business processes, and information and communication tools. In terms of achievement, for the implementing regulations, we have provided, when I say we, it's going to be the royal we all the time, but the project teams have been working quite hard in providing technical contribution to the implementing regulation. And this was done in June last year. So huge effort in less than 6 months. In terms of policy and guidance, lots of reflection papers have been prepared, and those reflection papers have been the basis for the preparation of good vigilance practices. Lots of guidance documents prepared, question and answers documents prepared and published on our website. Working agreement, very important. As you may be aware, this new legislation also establishes the need to cooperate more broadly with other institutions. And there is one specific article, Article 28C2, which is about establishing links between the agency, European Medicines Agency, and the European Monitoring Center for Drugs and Drug Addiction. So we had the first agreement or working arrangement in place in 2010, and this working arrangement has been amended recently. And this will allow, hopefully, a more timely response to potential public health threats. So that's a major step. Also, we are working towards collaboration with WHO and other partners. In terms of rules of procedure and mandates, also important work to update the rules of procedure for the coordination group, to prepare the rules of procedures for the new committee, the PRAC, and mandates for specific groups, for example, the Pharmacovigilance Audit Facilitation Group, which will have an important role in terms of pharmacovigilance audits. Lots of lists as well. This is coming from the legislation. Lists related to PSURs, lists related to additional monitoring. So lots of lists to be first created, and the process to create those lists can be quite heavy sometimes, and then to maintain those lists and publish them. Pharmacovigilance training, lots of people train, and today is a living proof of that. Detailed business process mapping, that's very important. As Peter has outlined, it's the biggest change. And to change, you need to make sure that you understand from where you're going. So the business process mapping has been, and will be a very important aspect to make sure that we are making improvement and that we are documenting and making sure that we know in which direction we're going. So important work. In terms of committees and decision-making, we have established a PRAC, and we are strengthening the interactions between CHMP, the PRAC, and the coordination group, CMDH. Lots of work in terms of templates. Important work in terms of providing industry with a format for electronic submission of product information, the famous Article 57 that you may have heard about. And finally, the EMEA corporate website, which has been significantly improved or upgraded in the context of this new legislation. Of course, the legislation foresees the need to establish an EU medicines web portal. For budgetary constraints, we were not in the position to establish this web portal, but we have a legal notice on our website, and the website for now serves as the EU medicines web portal. So, as I said before, lots of upgrade in terms of new page for general public on pharmacovigilance implementation, including videos, updated template for safety referrals, new search functions for all referrals, new page for industry and patients on pharmacovigilance implementation. And also, importantly, on this website, we have maintained lots of documents related to the implementation. And one key document is the plan for prioritized implementation. So you know that we had to come up with a prioritized implementation because we didn't have the money to cover all the costs linked to a full implementation. So in December 2011, the Management Board has agreed a prioritized implementation based on specific criteria for prioritization. The first set of criteria related to provisions having a significant impact on public health activities. Secondly, provisions having a significant impact on transparency and communication activities. And thirdly, provisions impacting on simplification activities, mainly for industry. For the sake of the presentation and the preparation of the plan, we have grouped the activities into four main topic areas: collection of key information on medicines, better analysis and understanding of data and information, regulatory action to safeguard public health, communication with stakeholders. And you will see a traffic light still on the journey, not started, for red, amber, ongoing implementation, and red, fully implemented. If I start off with collection of key information on medicines, we have agreed that in terms of risk management plans, we will establish and operate a new procedure for requesting and assessing risk management plans. And this has been delivered in July this year, with new templates available for industry in October, and the format will be compulsory as of January. In terms of periodic safety update reports, we have agreed with Management Board that we will operate a new procedures related to PSURs for CAPS. This has started in July. Also, development and publication of harmonized birth dates to support PSUR submission, one additional list, and we have published the first list in October. And this list is updated on a monthly basis. In terms of post-authorization safety and efficacy studies, we have implemented, as of July, the PASS procedure for protocols, approval, and results management for centrally authorized products, and the consultation on scientific guidance for PAS. At the time this presentation has been submitted, it was amber, and I'm pleased to announce that it's a green light now. The guideline has been published yesterday by the Commission for comments, public consultation until the 18th of February. In terms of electronic submission of core medicine information for MAHs, the Article 57, we have received the data. We are still receiving lots of data on a monthly basis, and the start of the validation of received information will be probably next year. A joint implementation group has been established at the agency together with industry, and we'll work on the best way, the best approach to validate those data. In terms of reporting by patients, we had agreed to cooperate with member states to provide information to patients on direct reporting. The core data fields have been agreed with the member states in June this year, but still as Peter mentioned earlier, we have a lot of work to do on this activity due to the disparity between member states. In terms of hydrovigilance and signal detection, operation of revised signal detection process that started, support to member states for signal detection for nationally authorized product. This has started. Start of signal management through the PRAC. That's done. That's fully implemented. Continuation of maintenance work for hydrovigilance data. This goes on as planned initially. And implementation of web publishing of ADRs on our website. This has been delivered in May this year. In terms of additional monitoring, the first list will be published as of next year. And there are two good reasons for that, or one very important or key reason, is that the legislation has been updated already, and the main change to the new legislations relate to additional monitoring. So we'll take on board those changes, and the related GVP module on additional monitoring will be then published next year. The list initially, in terms of scope and criteria to include products on the list, will be then further defined, and the first list will be published early next year. In terms of IT systems to support processing and analysis of data, we'll finalize the business requirements for enhanced IT systems, for example, hydrovigilance and the PSUR repository, very important one. And this work is ongoing. In terms of scientific committee, we have established a PRAC, and the new responsibilities for CMDH have been reflected in the new rules of procedures. Strengthening of referral procedures, this has been done, and the first referral were launched in October. Online publishing of information, lots of work, but so far we have published lots of documents related to PRAC and essentially PRAC in terms of agendas and minutes and meeting highlights. The plan is for next year to apply the same approach and to extend that to CMDH and CHMP. Coordination of safety messages, this is implemented. Public hearings, mentioned by Peter as well earlier. Discussion, very important discussion in March at management board level to define the modalities and the practicalities of public hearings. What will continue in 2013, basically everything which has been described earlier. So you can read for yourself here. The new risk management process will continue. In terms of PSURs, this will continue. Safety studies, this will continue as well. In terms of ADR, collection, training, data management, this will continue. Signal detection and management for CAPS and NAPS. We will strengthen the interaction between committees and coordination group. Publish adverse reaction data for CAPS, this will continue. Referral procedures. In terms of transparency, as I said before, we are moving towards increasing transparency, and the coordination of safety messages will continue. What is likely to be new in 2013, and this is important because it's subject to agreement by a management board in December, but that's the sort of flavor we should have in 2013. Legal proposal from the Commission on fees, very important aspect for the sustainability of the system. If there is no money, no funding, the system further down the line will probably collapse. So that's an important aspect of it. Several key scientific workshops to be held at the agency. One workshop on medication error, workshops on efficacy studies, and stakeholders fora. We are planning, and this is still subject to agreement, but we are planning 2 stakeholders fora next year. So those meetings are meetings where we gather industry, patients, member states, Commission, and EMA in the same room for 1 day. So we are planning to have 2 days next year, if the management board agrees with that. We'll maintain and validate the information coming from Article 57, establishment of procedure for collaboration for joint industry safety studies, meaning if you have a product or if you've got products with the same substances but with different marketing authorization holders, we need to put in place joint procedure for them to run the same post-authorization safety studies. So that's a very important step, and we'll work towards establishing the procedure next year. Publication of list of products under additional monitoring, as I said, and introduction of new black symbol and specific statements. Public hearings, publication of CHMP and CMDH agendas and minutes, revised process for pharmacovigilance inspections, and first EMA and National Competent Authority system audits. Key also to understand how the systems are working together. Beyond 2013, further IT development in terms of hydrovigilance and PSUR repository, EMEA literature monitoring for ADRs and entry into hydrovigilance, payments hopefully to rapporteurs, PSUR single assessment for substances not included in CAPS, program for monitoring effectiveness of risk minimization, and Peter mentioned the importance of it to make sure that the information we are delivering have actually an impact on the way drugs are prescribed or dispensed. So that's a very important important step. And public hearings, the aspect will be to enlarge the scope of public hearings and extend that to procedures beyond referrals. The key success factors so far have been the clarity in terms of governance, the roles between member states and EMA and other stakeholders, careful impact analysis, strict planning and project management, detailed business process mapping and process improvement and simplification where possible, dialogue and consultation with stakeholders, expectation management, and focus on the key objective. So in the coming years, we're planning to reinforce that and to make sure that we can, those principles support a successful implementation. And I'd like to conclude here. There is no reported delays, as they say, on this journey. So far we are on target. Lots of work ongoing, taking into account new amendment to the legislation. The funding and the staffing remains the key risk to system sustainability. And the journey is not over yet, but we have a good direction of travel, which is the focus on promotion and protection of public health. Thank you very much for your attention.
Thank you, Franck, very much. I think it's very clear. It gives a clear overview where we are. We are running a bit late, but I think maybe we can take a couple of questions and take the opportunity. Franck is here. Francois?
The measures that will be implemented at a later stage, like the direct reporting of ADR to EMA, does this also include the spontaneous reports from healthcare professionals and patients, or will this continue to go via the national competent authorities?
We haven't discussed this level of details, but well, to tell you the truth, I don't know at this stage, because the reporting aspects, as it was touched before, are the most tricky in terms of defining who does what within the system. Important discussions will take place at HML level, heads of medicine agencies level, and hopefully the picture will become clearer. But at this stage, I can't tell you what will be and what will not be, I'm afraid. But discussions are taking place, that's for sure. And the subject is one of the touchy subjects, as you can guess.